Ready to do Peri Care. So this skill will be done on the mannequin. Okay? So, knock knock. Good afternoon, Miss Johnson. My name is Angela, and today I'm going to provide Peri Care for you. But before I do, let me just go wash my hands and I'll be right back. I will wash my hands. I provided privacy, gather my equipment, 2 large towels, 4 small towels, my gloves, my basin. I'm going to catch water. I'm going to feel the water, make sure it's comfortable, but I'm also going to have Miss Johnson feel the water. Miss Johnson, would you please feel the water and let me know how it feels? She said it feels good. Okay. Alrighty, I'm going to go ahead and make sure the bed wheels are locked on both ends. I'm going to lower her head at this time because I'm never sure what position her head will be in. So I'm going to make sure her head is in the lower position. And she is in a supine position. I'm going to go ahead at this point and put my gloves on. I'm going to move my overbed table out of the way so the evaluator can see what I'm doing. Now, maintaining the patient's privacy, and I'm just going to remind myself that I did provide privacy. I'm going to expose the area that I'm going to work. So I'm going to pull her gown up a little, and I'm going to lower her blanket just a little. Now in this skill, you will find the catheter still in place. Try not to worry about the catheter too much, but at this point, we're going to leave the catheter out. That's another skill, that's catheter care. Right now, we're focusing on Peri Care. So I'm going to go ahead and put all 4 of my towels into the water. I'm going to take 1 towel, I'm going to fold it just like this, and I'm going to have Miss Johnson roll over. Now remember, this skill will be on the mannequin. I'm going to have Miss Johnson roll over, 1, 2, 3, and I'm going to push the towel under her buttocks to protect her bed. And you can just push the towel onto one side. Now, with my towels, the first towel, I'm going to make sure it's nice and wet, and I'm going to put my soap on. Soap. Make my towel soapy. And if you keep it folded like that, we've shown you how to fold your towels. Keep folding it like that. And using your right hand, if you're left hand, you use your left hand. And I use my right hand, and I'm going to wash from front to back. From front to back. Down on the side. And then I'm going to turn my towel, and I'm going to use another area of the towel and wash down the side, front to back, and then another area of my towel I'm going to wash down the middle. So that's my wash, and then I'm going to place the wash towel on the corner of the basin. And then I'm going to take my second washcloth, fold it. I'm going to rinse. I'm going to rinse front to back, right down, turn my towel. I'm going to rinse on the other side, front to back, and one more time, completely different area of the towel. I'm going to wash down the middle, front to back. That's to rinse. And then I'm going to place the towel on the side. Then I'm going to take my large towel, I'm going to open it up, and the first part of my towel I'm just going to use to dry. So I'm going to dry front to back one more time using another area of the towel. I'm going to dry front to back. And I'm going to just fold and tuck that part of the towel in and rest it here. Got to practice that. Now the patient is nice and dry and clean at the front. Now I have to turn the patient over and wash the back. I'm going to have the patient roll over. So you have to position your mannequin so that you provide privacy and the patient is stable. My third towel, I'm going to put soap on it. Make sure it's nice and soapy. I'm going to make sure it's folded, and then I'm going to wash from the front to the back. I'm going to turn my towel. I'm going to do it again, front to back, and one more time, I'm going to wash front to back. I'm going to put this on the side, and then I'm going to use one last towel, the fourth towel, fold it. I'm going to rinse front to back, turn, front to back. One more time, I'm going to rinse front to back. And then I'm going to take my towel, using the other side of the towel, I'm going to dry front to back. One more time, front to back. Make sure the patient is nice and dry. Then I'm going to take all my towels away. Before I go, I'm going to make sure the patient is safe and stable. Okay, Miss Johnson, just give me a minute. I'll be right back. I'm going to take all of my towels, including the 4 washcloths and the 2 large towels, and I'm going to go ahead and put them in the soil container without contaminating myself. I'm going to take my soap over to where it belongs. I'm going to take my wash container, rinse it out, rinse. I'm going to take a paper towel to dry, and I'm going to put it in the dirty designated area. I'm going to take my gloves off correctly, wash my hands, and come back over to the patient, and I'm going to say, Miss Johnson, as usual, you did a great job. And so I'm going to cover her over, make her comfortable and tidy, and then I'm going to lower the bed back down in its lowest position. I'm going to give Miss Johnson her call light. Miss Johnson, thank you very much for allowing me to assist you. I'm just going to tidy up, and I'm finished with that skill.